First, we've got to talk about the numbers. The U.S. has suffered its deadliest day yet from the coronavirus. More than 3,000 deaths were linked to the virus yesterday, topping the previous record set just 6 days prior. According to NBC News data, California, Illinois, and Pennsylvania all recorded more than 200 deaths yesterday, while Colorado, Idaho, North Dakota, and West Virginia broke records. The U.S. also reported its highest number of new infections yesterday. Nearly 223,000 new infections, with Texas, California, and Ohio leading the way. Willie, these are horrendous numbers.
Yeah, 3,000. When we hit that number, a little under what we saw yesterday on 9/11, it completely changed the way we live. Let's see if that happens here. According to new analysis from the New York Times, more than a third of Americans live in areas where hospitals are running out of room for critically ill patients. Using data from the Department of Health and Human Resources, the Times found hospitals serving more than 100 million Americans reported having fewer than 15% of their ICU beds available last week. The data also show that 1 in 10 Americans across much of the Midwest, South, and Southwest live in areas where ICU beds are either completely full or at 95% capacity. But we could have a vaccine approved here in the United States as early as this afternoon. An FDA advisory committee made up of nearly 24 doctors, including vaccine and infectious disease experts, will meet later this morning to begin the authorization for approval of the Pfizer vaccine. Top health officials say it's not a question of whether the vaccine will be approved, but how quickly it will begin to be distributed.
We could then have an EUA within days and be administering doses of vaccine to our most vulnerable next week. As we've discussed, based on current production schedules, we expect to have enough doses to vaccinate 20 million Americans by the end of this year, 50 million total by the end of January, and at least 100 million total by the end of the first quarter.
The biggest issue now might be getting people actually to get the vaccine twice, which could prove more difficult than developing a history-making vaccine that is roughly 95% effective, Mika.
Joining us now, physician and fellow at the Brookings Institution, Dr. Kavita Patel. She's a former Obama White House Health Policy Director and an MSNBC medical contributor. And I wonder if the question is this. It's one thing to get the approval through and to get the vaccine approved on every level, but I wonder what the Trump administration is actually going to be able to hand over to the incoming Biden administration in terms of planning to distribute the vaccine, which is not an easy task.
Yeah, that's right, Mika. And they need the Biden-elect team today, actually 2 months ago, really needed information on how the contract manufacturing process, the numbers, quantities, what the plans were for distribution to the states. The states have submitted their plans to the feds multiple times with numbers revised just as recently as last week. But the other way around, that information, Mika, has not been going to the Biden team. And you saw President Trump even held a summit earlier this week with not a single member of the transition team even invited. And then furthermore, I think, just as you've said, the most important piece of this is having a clear message about safety and how Americans can access this vaccine. The most common question I'm getting is, okay, doctor, I know I'm not the first in line, but when will my turn in line be and where do I go? And Mika, a lot of us don't have those answers.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.